this thing on? Yeah. So contrary to what my mother thinks, I don't sit on Facebook all day. Although sometimes it feels like I do. Can you hear me? Yeah, so one of the cool things about my job is that I get to build online communities for people that are engaged in health and health research in Vancouver and around Canada as well. One of the things, or this is one of my favorite cartoons ever, because as a science communicator, I feel like I exist in one of these little bubbles all the time. And what this slide really speak to as well is one of the most difficult parts about this system is how slow it is. We work in this slow-moving wheel of evidence-based change. Can anybody guess just how slow this is? This is new to me. One moment, slide change. It takes an average of 17 years to move something from evidence into practice. Trust me, you can Google it. Just to, God, trust Google. To put that into perspective, 17 years ago in 1995, Newsweek published an article that said the internet was just a fad and it was never going to take off. And this is where we are today. So that was a lie. So this is the world that we live in, and this is the world that I work in. It's this interconnected, fully communicated, collaborative community. And I feel like health in this like slow-moving, evidence-based cycle is just trying to work with this, but right now it's not working. So that's really where people like me come in. The idea of communities of health is not, or communities of care is not new to health. We've seen this in HIV. We've seen this long before the internet showed up in HIV and in other communities. But HIV does this quite well, continues to do it quite well in terms of building community-based organizations and community advisory groups that connect, collaborate, and move forward. And this is still happening today. This is a group of 4 people that in 2010 worked in 4 different areas around the world in HIV. That's me on the left. UNAIDS, thebody.com, and some different places in the States that connected at a tweet-up at a conference and was able to discuss ways to build partnerships between patient communities and providers. We also see this in maternal health. This is a group I work with at BC Women's Hospital called the BC Cesarean Task Force. They have a very specific mandate, which is to lower the cesarean rate in the province, which according to the WHO is too high. So what we did was we connected with them to find a way in which we could create an education campaign that would educate both women and healthcare providers to learn their birth options so that people just wouldn't jump to a cesarean. So what we did is we set up a public health campaign called the Power to Push campaign, which is a website and different social media channels that provide resources to both women and healthcare providers, maternal care providers, about education around birth options. And one of the really cool things that we did is we set up these online communities in which we engage with women and healthcare providers on a day-to-day basis. This is an example of some of the birth stories that we see on Facebook. And women are encouraged to just share their stories about how they gave birth and how that happened, and other women talk back and forth, and it's just a really great environment. We've also set up a Twitter page as well, which has been really cool in connecting with birth advocates and care providers and moms outside of BC. We've been able to connect with like-minded groups in the States, and what this has turned into is this global connected environment where we can discuss and share best practices. So those are just some personal examples, not just in those isolated silos, but websites like Patients Like Me create these collaborative, or these communities of peer-to-peer healthcare in a way. So this is a website in which patients, like-minded patients that are all experiencing the same things can connect, oh no, it's kind of fast, can connect around the same treatment items and discuss and share stories. This is a really interesting community. If anyone's on Twitter, check out hashtag HCSMCA, that's Healthcare Social Media in Canada. It's a Twitter chat in which a bunch of us Twitter people get together at 10 a.m. on Wednesdays and discuss healthcare and social media in Canada. Fun fact, the PubMed article up there is the first paper I ever had to turn into a press release. Try doing that. Anyway, check out Mendeley. It's a really cool research research sharing website in which you can upload documents and share them and discuss research papers online. Here's some other cool ways in which Twitter is being used, that not just for Justin Bieber, but in some really cool ways to discuss new research and new peer-reviewed stuff. Research Blogs discusses latest peer-reviewed. Twit Journal Club is an online journal club that discusses some of the latest medical research. They get together every Sunday, I think it's 10 a.m. This is another interesting way in which a hospital leveraged the web to do some training. So 2 years ago, a center in Seattle live tweeted and live streamed the first knee replacement surgery. These guys, a couple weeks ago, just did the first open heart surgery. So it's a really interesting way to set up those training opportunities. Sunnybrook Hospital in Toronto has set up MyChart, and we also have something similar in BC. I think it's called My eHealth, and it's an interesting way of giving patients immediate access to their data, which is important. Oh, this is going really fast. Another thing that the social web really, or an interesting opportunity the social web provides, is virtual house calls. So here's an example of a doctor talking to a patient that that's not in their office, someone at home. So it's a great way of connecting patients with experts and just creating that conversation over the web. Mobile health, it could be its own topic by itself, but essentially more people are accessing websites through mobile devices than desktop computers. That's a fact. So and this is translating into health as well. We're seeing people tracking their own health, their running, their nutrition, everything on their own phones, and sharing and connecting with others. So what are my hopes for a better healthcare system? This isn't really a Back to the Future hoverboard thing. This social web, social communities, online communities talking about health is happening right now as we speak. So my hope is that we will all continue to leverage these tools to maximize, to collaborate, to build communities around health and towards better health for everyone.